Ewing Sarcoma. So it is otherwise known as endothelial myeloma or round cell sarcoma. And it was first identified by James Ewing in 1921, hence the name Ewing Sarcoma. And the important thing is that it's one of the most common primary malignant tumor usually occurring among the children. And the Ewing sarcoma family of tumors consists of an array of different types of tumors, which include Ewing sarcoma, PNET, that's peripheral primitive neuroectodermal tumor, then neuroepithelioma and Askin tumor. And there is a gene fusion, that is EWSR1 or FLI1 fusion is a important feature of the Ewing sarcoma. Coming to the clinical features, so it is usually a disease of young age, that is 5 to 25 years of age group, and male to female in the ratio of 2:1. And usually there is an episode of trauma which often precedes the development of the tumor. Also, intermittent pain and swelling, these are the earliest clinical signs of this tumor. And most common location is the long bones of extremities. And in jaw bones, it is seen in 13% of cases, and among the maxilla and mandible, it is most commonly seen in the mandible. And the features associated with the oral cavity or the facial structures are the facial neuralgia, lip paresthesia, and loosening of the teeth. And there is rapid jaw swelling, and that swelling get ulceration of the intraoral mass. So this is one of the important features. And along with that, there is constitutional symptoms which include low-grade fever, elevated WBC count, and weight loss and anemia. And the Ewing sarcoma can also affect soft tissues. Then, in that case, there is no gender predilection, and it is more common in the trunk region. Radiographic features, usually seen as irregular, poorly defined and diffuse radiolucency. But there is formation of layers of new supraperiosteal bone that is resembling to the skin of onion, that is otherwise known as onion skin appearance. This is especially seen in case of long bones when compared to maxilla or mandible, and it is seen like that. There will be cortical thickening or the new bone formation which will exactly resemble the onion skin. So, onion skin or onion peel appearance is a characteristic radiographic appearance of the Ewing sarcoma. And sometimes there is sundry appearance if the osteophyte or the new bones formation occurs. Histopathologic features, it is an extremely cellular neoplasm, that is there will be lot of cells. Connective tissue stroma is usually very less. Then there is solid sheets or masses of small round cells with very little stroma. That is why it is known as small round cell sarcoma. And cytoplasm is usually scanty and large round or ovoid nuclei with dispersed chromatin and hyperchromasia. So, there is a characteristic feature. And usually the sarcoma cells are arranged in a filigree pattern. Here we can see the pattern, that is there will be the cells or then arranged in a filigree pattern, and when looking at the each cells, it is usually small round cells with dense hyperchromasia. And in between them, mitotic figures are usually common. There will be numerous mitotic figures in between these cells. And the cells are usually positive for glycogen, and it is usually diastase resistant. And there is necrosis, which is known as geographic necrosis, and perivascular sparing, that is necrosis usually spare the vascular area. Treatment and prognosis. So, radical surgical excision, that is the amount of the tissue removed is much more. Along with that, X-ray radiation should be done. And it usually has a very poor prognosis and metastasis very early.
Download Blulines now, redefining quality education.